Hello everyone, this is your host Avik, and today we have with us Dr. Pearlin, who is a general physician and a diabetologist with Idea Clinics. She's been helping patients out for more than 15 years now. And since we are in this time of the pandemic with the COVID rampant, we thought it would be better to have her perspective and insights into this thing. Welcome, ma'am. So, first things first, like now that this virus is spreading further, we are seeing a lot of variants coming up, particularly Omicron in that respect. So, what is this virus all about? Can you please tell us something about it?
Yeah, see, when we think about Omicron, we should not think that it's a different virus. It's the coronavirus. So, coronavirus takes different like avatars or like different generation. So, first it was like alpha, then beta, delta. So, now the next generation of coronavirus or SARS-CoV-2 virus, we will call it. It is called, the name given is Omicron virus.
Right.
Yeah.
On that note, are there any new symptoms that you could relate with this particular Omicron virus? Because, of course, in the first wave, we had certain symptoms. Are there any new ones that could distinguish that, hey, this is Omicron, this is not?
There are no much new symptoms, but all the general symptoms are there, like body aches, low back pain, headache, and the symptoms mostly limit to the upper respiratory tract. So it will be either nasal congestion or running nose with throat irritation or throat pain, and sometimes it is going to sinus also, like viral sinusitis. But in contrary, when it was a Delta virus, mostly it went to lower respiratory tract infection. So there only people had breathlessness, pneumonia, all that things. So this Omicron limits itself to upper respiratory tract.
In terms of diet, because people are conscious and people get wary about the dietary things, so what are the dietary precautions that one should take in order to keep themselves protected from this particular virus?
There is no dietary restriction. So better to avoid junk foods only, which are not healthy, but better to have a healthy, balanced diet. We should keep our immunity up to date. That's the thing.
And since you were mentioning that we should, of course, prevention is better than cure, but then again, we have seen this trend. Like there is a surge in the number of cases, again it comes down, things become stable once again. Now, in this scenario also, how dangerous does this look? Like over here also, the number of cases earlier had gone up, now it's coming down. Again, the new variants are knocking on the door. Now, how dangerous can this be?
Virus means there will be always mutation. Without mutation, a virus can't survive. So virus will keep on changing. So accordingly, we can expect the waves. But to face these waves, we should be ready with, as human, we have knowledge and we have science with us. So we should take all the preventive measures to how much we can reduce the burden to the nation and all these things. So main thing what we can do is vaccinating everyone. Okay. And second thing is the mask, which we all used to now since 2 years. And the third is to avoid crowded places and keeping the social distancing.
Absolutely.
Fourth, keeping ourselves clean hands. So that will help. And yeah, we expect more waves in future also, but we should arm ourselves with these precautions.
Absolutely. And since our viewers, most of you probably have been vaccinated and all, and it's common knowledge that of course you need to take the vaccines to keep yourselves protected. But then again, ma'am, we've also heard that people who have taken 2 doses of vaccines, chances are they are prone towards getting infected by this new variant. Is this true, or how does this work?
It's true. So when we come to vaccines, okay, we can say there are different type of vaccines. First vaccine we will say about mRNA vaccine. So in that we will be sending one mRNA of the virus into our body. So to that antibodies will be generated by our body. Okay, so that only Pfizer and Mrna, they all come under that. The second thing is we will call that as vector vaccine. In that we will use another one virus as a vector, and we will send that viral information to our body, produce antibodies. So that example only our Covishield, okay, AstraZeneca and our Covishield. And third, what we can say is inactivated virus, attenuated vaccine we will say. Same coronavirus, we will make it inactive and then we will send into our body. Okay, that virus, that vaccine only our Covaxin. Okay, so most of the vector vaccine, mRNA vaccine, they all aim to produce spike proteins. We are sending the spike proteins in our body and our immune system has produced spike antibodies. Okay, but when it comes to Omicron, the mutations happened in the spike only.
Okay.
So now these spike antibodies are not working.
Understood.
You got the point?
Yes.
So when it was Delta, the spike was very active and that spike only went into our lungs and it got attached to our ACE2 receptors and caused all the diseases. But now that spike has changed itself.
Correct.
So because of that, the spike antibodies are not having much role now, but it gives us a overall coverage, overall protection for the disease.